15 points lower than a high of 24.4 in November. Hospitalization has significantly decreased as well. This is extremely encouraging news, and I want to again thank Missourians for their efforts. As far as vaccines, we will reach a milestone of well over 600,000 doses administered to Missourians by the end of this week. Vaccine supply continues to be the limiting factor, but we are committed to fairly allocating doses throughout the state and working with vaccinators to ensure efficient administration of the vaccine as quickly as possible. This week, the second round of regional mass vaccinations will take place in the following counties: Henry, Marion, Rawls, St. Francis, Greene, Pemiscot, Cole, Douglas, Livingston, Harrison, and Phelps. Week one of the mass vaccination took place last week, with nearly 20,000 Missourians receiving an initial COVID-19 vaccine. We are very pleased with how well these events have gone so far, and we greatly appreciate the help of our National Guard and our local partners in these efforts. In addition to these mass vaccinations, we recently announced a partnership with selected hospitals in each region of the state to support high throughput vaccine distribution. These hospitals, which were selected based on ability and a rapidly administer vaccines, will receive just over half of the state's weekly vaccine allocations through the end of the month. Individual allocations for each hospital will be based on the regional population. We are hopeful that this partnership will provide the consistency needed for effective planning of high-volume vaccine clinics at the local levels. The remaining allocations will go to the local public health agencies and other enrolled community providers. And let me add to that. We have had issues with the distribution process, put it in certain areas, certain facilities, healthcare providers, was following the guidelines that the state has provided. I will assure you, as governor of the state of Missouri, we are going to vaccinate the most vulnerable citizens in this state and people 65 years and older with health conditions that meet those standards. We are not going to allow people to administer however they want to administer. The guidelines are clear. There is no misunderstandings. So this is part of the process that we're going to put in place to be able to help that group that is in that tier, and we are going to maintain that. If that is not followed, then we will do other actions to make sure that that vaccine goes to the people who actually need it. I understand everybody wants a vaccine, and people want to jump the line, want to address issues. We have to be disciplined because right now, with the supply that we have to put it to the most vulnerable people that we need to right now and the people at the highest risk. We also received news this week that the federal government will be increasing over our weekly Moderna allocation by 5%, which will help with supply. Again, I want to remind Missourians that this is a gradual and ongoing process. Just as we face supply challenges with PPE and testing at the beginning of COVID-19, the vaccine is no different. But we remain focused on working through our plan as quickly and efficiently as supply will allow. We continue to encourage everyone to visit mostopscovid.com for the latest updates and information, including available vaccinators in your area and our new COVID-19 vaccine dashboard. It will take time, but I want to assure you that we are committed to giving every Missourian an opportunity to eventually receive a vaccine regardless of where you live. Thank you and God bless. Kelly, I think Dr. Williams is here. Questions?
Thank you, Governor. Three things I want to talk about real quickly. First, I want to thank two media outlets. Yesterday, we were obviously with the House for 3 hours and greatly appreciated them having us there to answer questions. When I got up this morning, we were 7th in the country for cases per 100,000 over the last 7 days, and two media outlets reported that, and very much appreciate you doing that. And my mother, if she was here, say it sounds like you're bragging. We're not bragging. It's really what we're doing is thanking Missourians for following those guidelines that we would hope that they would do to stay safe. So it's really a testament to them. We know from studies that when physicians suggest and affirm behaviors, it reinforces those. So when you report that out, it tells Missourians, gosh, the next closest state is Iowa, which is 18th. That's around us. We must be doing something well. Let's keep doing that as we go into the Super Bowl. So I appreciate the two media outlets. I read all of you, or watch all of you too, and very much appreciate the two reporting that out last night, and thank Missourians for doing that. It's really made a difference. To those who say, well, you don't add antigen tests, well, neither do 23 other states. And when we added antigen tests 2 days ago, it didn't change our ranking. It's a small enough number that it just doesn't change it. So that's not the factor there. It really is that in Missouri, we are 7th in the country. So again, to you for reporting it, affirming that behavior, encouraging people to keep following that behavior, we thank you. Second thing I want to touch on is the variants. We still do not have the UK variant in Missouri, which we're thankful for. Kansas had it yesterday. 33 states do. 2 have the South African, 1 has the Brazilian. We continue to look at 500 samples a day. We will have either by tomorrow or on Monday the ability to do our own gene sequencing. We're sending out about 25 tests every 2 weeks that flag is suspicious, but so far they've all been negative. But we're watching that very carefully. And the third thing I want to talk about is kind of late breaking news, so I won't have the complete details for you. I was on a phone call with the White House earlier this week. The governor was on one, then I was on later that night. On Monday, we will get from the CDC, there is a new federal program to give to pharmacies that they've identified, either Walmart or Health Mart. And Health Mart is the McKesson distributor that's independent pharmacy. So a lot of those are in rural areas. And on Monday, we will get a list. It's from a list of about 880, but they're only doing Walmart and Health Mart. They're not doing CVS or Walgreens. And they pick those two because they're third and fourth in size. And they will identify a certain number of pharmacies, we do not know yet how many, that they will be directly distributing vaccine to that will be available on the 11th. That does not come from our allotment. That comes straight from the federal government. It's a federal program to try to reach underserved areas. They're going to start with Walmart, and then they'll move to Health Mart. We'll let you know on Monday. That list will be available from us on Monday as soon as we get it. And then on the 11th, people in those areas would contact those Walmart pharmacies that they have picked, that the federal government picks, that not us, to register to sign up for a vaccine. So I don't know which pharmacies, I don't know how many, and I know they're going to be Walmart, and I don't know where they're located, but that will be available on Monday, and we'll make that available to you. The governor stole my thunder, but I just want to reiterate that it is in the DNA of Missourians, as I said, to care for other people, but it's also in Missourians to be fair. And we do get reports of people who are purposely, talking about vaccinators, deviating from our guidelines that are required by the federal government. And they get a phone call. And yesterday I called one, and they confessed and just explained to them very clearly that we are going to prioritize our most vulnerable. And that any deviation from that, as the governor said, will be met with consequences. So I want Missourians to know that when it comes to our attention, that somebody's purposefully deviating from those because they just decide they want to do that, we do deal with that, and we deal with that robustly. So thank you. Happy to answer any questions. If you want.
Questions, Sebastian?
I've got another one from Jacqueline after this, if that's okay.
That's fine.
Okay. So I was looking at the plans and reports on the 2009 H1N1 pandemic and how DHSS dealt with that, or dealt with that then. And there was a lot more emphasis on local public health agencies coordinating vaccinators, doing vaccine clinics themselves. With this new model that's
Yeah.
prioritizing throughput hospitals, it seems like they're in charge of that, and the public health agencies, aside from St. Louis County, are kind of in the back of the line. Can you explain why that prioritization has changed?
Yeah, I think the big factors were this. One, the federal government heard from all around the country and said, okay, we're hearing this lack of predictability is a real problem. So we are going to tell you how much vaccine you're going to get, and we're going to predict that for the foreseeable future. So that gave us the chance to listen to the same people who said, the Barnes Jewishes that had proven they could give 5,000 doses in a week. It would really help us if we could say to people 2 weeks in our community, not people in their hospital, but in our community, that we'll have a clinic. So our qualification was, can you give 5,000 immunizations in a week? That helps us very much with our kind of reporting and knowing those vaccinations are getting arms. And when we looked at our large healthcare systems in each region, they had proven back in December that they can do that. They can get 1,000 shots a day in arms. When we looked at our universe of local health departments, 115 if you count St. Louis, many of them just don't have that capacity. However, it is clearly the expectation of us that as we work with these proven entities, the Barnes Jewishes, the St. Luke's, the SSMs, the Coxes, the Mercies, that they integrate with their local health departments, St. Louis City, St. Louis County, Kansas City. And it's in everybody's best interest, especially the hospitals, that the most vulnerable get vaccinated, because if they don't get vaccinated, we'll see a situation we saw back in April where they're overburdening their ERs and their intensive cares and those kind of things. So it is clear an expectation that they vaccinate 5,000 people in 7 days, they report it, and that they work with local entities, FQHCs, health departments, to coordinate those efforts.
And Jacqueline wanted to know, what's the plan for people not showing up for their second doses? They have their first dose, and then 3 weeks or 4 weeks later they have their second dose. So what's the plan to address that?
Yeah, I just sent an email out to get clarity on that from some national thought leaders. The first answer to that is that we want you to get your second dose as soon after the first dose as you can. And so you do not start a new series. Okay, so that's the first answer to your question. But then your second question I would propose is, well, what if 6 weeks go by or 5 weeks go by and there's no evidence that they're coming back? And we're looking for clarification on that today to get an answer to that. What is the time limit? Hey, Kirk.
So who deviated, and what's the penalty for what they did?
I'm not going to tell you who it was. It came to my attention. A pharmacist in an area called us and said, look, I just know that they are giving it to a group that's not. And so I called him. I called the CEO of that institution, and I said, true or not true? He said, true. And I said, why? And he kind of went in. He said, I'm just going to tell you, we did it. And I said, well, let me just be real clear with you. That is not fair to the rest of the Missourians. And in this particular case, they purposely did a class that there are a lot of those people in Missouri, and they all found out about it and called and said, why do they get to do that? And made it very clear to him that the future distribution is based on following the rules, and did he really want to hurt his community by not being a good steward of the vaccine we had entrusted him with? And it's not going to happen again there, I don't think.
And then when's the target date for moving to the next tier of vaccination?
Yeah, Kurt, it's a great question. I get that. If you'll give me the caveat based on what we know now, with hopefully the J&J, I'm waiting for word from the ACIP today to see when the date is for the EUA, which I'm told it's going to be late February, and that vaccine will be available in early March, we think, because I've got to write a standing order for it. And then hopefully the AstraZeneca coming on in late March. Based on that universe, which is a predicate, based on that universe of 4 vaccines, J&J's already promised 100 million by July in the United States. Based on that math, my hope would be that we will be moving into Tier 3 of Phase 1B in early April, mid-April, and that we would get to Phase 3 by mid-May, and that I was asked yesterday in the hearing, what is our end game? And it's very clear. Our end game is that every Missourian who wants a vaccine gets one. And we reasonably think, based on things Tony Fauci has said, that will be by June or July.
Okay, Dr. Williams, this question, I just need some explanation. I've been thinking about it all week. So the state received yesterday, I checked with your office, 737,000 doses. That's how many that our vaccinators have received here in the state.
Yes.
As of last night, they've only administered 485,000 of them, and this is coming from your office.
Yeah.
So I just have to ask, we're saying that there's not enough vaccine to give, but there's 300,000 doses somewhere.
Okay. So there, again, and I understand just as the hearing yesterday, the math can get confusing. So when you say we've received, that means that they have been shipped. And so let's just say Barnes Jewish gets 10,000. They have 7 days, or up to now they've had 10 days, but now they have 7 days to give that. So right there, 90% of it, at that moment in time, they're doing everything right, but 90% of it won't have been vaccinated. So it'll be like, oh gosh, where's the other 90%? Where they're in the process of vaccinating. So that's the first thing. The second thing is that when I looked at it this morning, there were only 130,000 of that 780,000 that we could not account for why they hadn't been vaccinated. Either they haven't been vaccinated or they haven't been reported. So there's several universes of numbers, and offline we can go on to this. There's the amount that we've quote unquote been allotted. There's the amount that we've been shipped, but we don't know where that is. There's the amount that's been received. You've got first and second doses. And then you've got the part that we truly go, okay, it isn't in arms. What are they doing with it? They either haven't vaccinated it yet or they haven't reported it. And as of this morning, when I looked at it, that was about 139,000 doses in Missouri of that total number. But I'm happy to walk that through. But I understand, and Robert Nodell talked about that yesterday, that you see this big number and you go, oh my gosh, I mean, that's like 50%, but it's not. Thank you, Kelly.
Governor Parson?
Yeah, this is off the COVID-19 forefront for Governor Parson. Hello. So regarding the overpayment of unemployment benefits, last week you said most certainly people should have to pay those back because you said some of those people tried to fraud the system. But what about those who didn't, who just came across this problem?
Yeah, I'm not sure what the legislature is going to do, but I think it's obvious if you've got an overpayment, there should be some ability, and under the requirements of the law, we're required to do that. So to not ask for it back or just says, hey, would you take that upon yourself to do that, I think, I don't think if there was a mistake made on both sides, there ought to be some mutual understanding of how we make that difference. So if that means somebody paying something off over a 5-year period of time or whatever the time slots are, if they know they got it and can, then they should, because that taxpayer money going from some other program. But we'll see what that plays. But if and I think two things have to happen to answer your question. The people that committed fraud is a whole different issue. So I don't even want to put them in the same bucket, I guess I want to say, as hardworking people that lost their job that's never been through the system before. And when you look at how much that was, I mean, I remember at the time we brought in 100 employees, just try to prop that up to be able to handle that. So the big thing we were trying to do was get money to the people that really need the money that's out of work. So there was mistakes made. There's no doubt about that. But at the end of the day, I think there is a responsibility as taxpayers' money. If somebody got more money than they should have got, you should ask for it back and says, hey, you owe that to the taxpayer. You don't owe it to me, but to the people that paid it. Because there's going to be somebody else tomorrow wanting unemployment benefits too.
And I'm sorry, I have a second part.
What, if anything, are you doing to repair your relationship with the Speaker of the House after the whole speech debacle?
You know what? We're going to move forward. We're working with the House and the Senate. This is not about me and the Speaker. This is about the state of Missouri and moving forward. And I got confidence in the Speaker. He's going to want to do what's best for Missourians. That's what I'm going to do. And we're going to continue moving forward. So I know a lot of hype in the media about all the things between me and the Speaker. And I've read some of it. I've learned stuff just reading what you guys are writing. I didn't even know existed. But anyhow, the point of it is he's got a job to do. I got a job to do. And I'm going to move forward for the people of Missouri. And I'm satisfied the Speaker will too.
The second part to my question there. Representative Crystal Quaid says there are negotiations of federal forgiveness of payments, but what about the state?
On the
Like on unemployment, overpayment of unemployment benefits. I know she said that during a press conference.
Yeah, I have no idea what she said during a press conference, you know. I guess what they're doing on the federal level, I don't know. All I know is where we're at on the state. I know the legislators are working through this. And frankly, I don't know what the feds are doing. And really, for me, it's about worrying about Missourians and worrying about how we get a vaccine. You know, if I was the minority leader, I'd be worried about trying to explain to 65-year-old people and vulnerable people out there why you jumped in a line in front of them and took a vaccine when you know good and well you wasn't qualified. That's what I'd be worried about.
Hi, Erin Davis, Channel 8. What would you say to teachers who are having to work in person and still have to wait till mid-April, early April to get the vaccine?
Yeah, I wish I could get a vaccine to them quicker. I think the whole thing we're talking about is we want people to be in school. You know, all along I've said I want people in the school systems. And over summer school, there was kids in summer school all through this year with no incidents. Fall started. The vast majority of the schools in this state were in session in classrooms, and to do that. We want to get that vaccination to teachers as quick as we can. Again, it goes back to risk factors of who's qualified that, and you've got to have a tier structure. That's why when certain officials were allowing people, just anybody to get a shot, you know, in this vaccine, you're delaying the whole process. Because the sooner we get that tier done, the better we can move to tier 3. And as long as we have people out there deciding, I'm going to vaccinate whoever I want, that's a problem for the whole system. And you really are keeping those teachers from getting a vaccine quicker. So that's why I stress it's so important. Why I've told Dr. Williams to get involved a little more in trying to be disciplined on this with these agencies. But the longer it takes to get through this tier, the longer it takes to get those teachers. And my goal is to get those teachers as soon as I can to get them in classrooms.
Governor Parson, last night your Deputy Chief of Staff told lawmakers in the hearing that next week the state hopes to allocate those doses from CVS and Walgreens. That's what you guys were told.
Yeah.
Do you have any idea when next week, and also how much? Obviously, we know that there's a lot that they didn't use in their program. So were you told how many doses the state's going to get from that program?
Well, I can say this. I'm pushing about as hard as I can to get everything I can. And if that's 100,000 or that's 50,000, I want everything they're not using. And there's no use to drag this on. I think this goes back a little earlier to your numbers, too. Those numbers that we're talking about right there are part of those numbers that we're counting against us as showing doses we haven't used. Those have been allotted to CVS and Walgreens. And it's ridiculous not to be putting them people's in arms when they're allocated to them. So we want to get those doses back into our system because we know through the National Guard and the healthcare systems, we can utilize them as of today. So we're going to get every bit that we can get from them, and the sooner the better. And we're going to push hard to do that.
There's no number, though, at the moment?
You know, I'm not for sure. Yeah, I'm not sure what they asked for. I know it's somewhere arranged. My understanding was initially it was somewhere between 50 and 100,000, but I don't know what that number is. That was a brief I had, but don't hold me to that. My staff would know a lot more about that than what I would.
All right, thank you, Governor Parson.
All right, thanks everybody.
Can you show us your jacket again?
You got it.
Thank you.
All right.
What's your prediction?
35-21 Chiefs.
And is there a bet?
There is a bet. There is a bet. If I was him, I wouldn't have made one, but anyhow. I would just say this. I talked to the governor, and we'll be doing a little bit more on it. I always do a Missouri gift basket, a nice gift that I do with Missouri products in it to showcase Missouri a little bit. The other thing, one of the discussions that me and him are having, working through right now, is whoever the loser is, which will be Florida, will wear the other team's cap to work and wear it behind the desk. So for me, I'll probably wear the Chiefs cap one way or the other. It doesn't matter on that. But that's the bet that I know of for now. But I'm looking forward to it. You know what? As many struggles as people went through this year, it's kind of fun every once in a while to try to be upbeat about things. And I think having the Kansas City Chiefs and representing us in the Super Bowl is a good thing for a lot of people to be able to have something else to look forward to this Sunday. So I'll be one of those people be looking forward to it. Kelly's telling me everybody, the media's wanting to know where I'm going to watch the football game at. Number one is be wherever there's TV at. It's where I'm going to watch it at. I can tell you that. But we plan on being the First Lady, plan on being at the mansion and watch the Super Bowl from there. Other thing, so we don't get any misinformation out there. We had the opportunity to go to the Super Bowl. And last year I had that experience, a wonderful experience. Would love to go this year to support a Missouri team, but the reality of it is, I think with everything else going on right now, I feel like I need to be here. I feel like I need to be here. And with Patrick Mahomes, Coach Reed, that organization, I think I'll have more chances to go to the Super Bowl as governor of this state. So thank you all very much. Thank you.